What's interesting is we think of people with high cholesterol as people who are overweight and eat fast food and don't take care of themselves. But in fact, there's a lot of genetic causes for high cholesterol. Bad cholesterol, or LDL cholesterol, is the type of cholesterol that forms plaque and starts to stick to the sides of your arteries. And when that happens, the arteries become narrowed and blood doesn't flow through them as well.
I usually like to divide my risk factors into what's modifiable and what's unmodifiable. Non-modifiable risk factors are things that you can't control. I can't control my age, I can't control my sex, I can't control my race. I can't control the certain genetic milieu that we're born into, but I can control the foods that I eat. So if you're consistently exposing yourself to fatty foods, fried foods, you basically saturate all of the enzymes in the body that can break down that cholesterol. So then it starts to build up.
If you don't exercise or are overweight or smoke cigarettes, these are all very significant risk factors for high cholesterol.
So there are some factors that are genetic and you may be born with that lead to your risk of having further disease. But the reality is that the bulk of the disease that we're seeing in this country is secondary to our poor lifestyle.
Many people in this country and in the world have familial hypercholesterolemia, where they have very elevated cholesterol levels. And it's a genetic cause. It really doesn't have to do with what they're eating or how much they're exercising.
Another factor that is often missed in patients in terms of their risk is something called lipoprotein A. And this is a cholesterol marker that leads to plaque, but it also increases your risk of clotting and has been under-recognized in the past. In the future, we may very well be treating that marker directly, and knowing that you have this predisposition is extremely important because you'd be open to a completely new treatment regimen that'll improve your risk.
I've had many patients, I can think of a marathon runner who's done multiple marathons but has an LDL cholesterol that's very high, and that puts that patient at risk. And so despite the fact that this person runs and is highly fit and athletic, they take a statin because they want to lower their cholesterol. So you can't feel your cholesterol level. There's no way to know what your cholesterol is just by feeling your body or even necessarily by symptoms. So we advise that everyone get their cholesterol checked over the age of 20, every 4 to 6 years. But if you're someone who's at risk for heart disease, it's important to be aware that you may want to be more proactive about getting your cholesterol checked.